In vitro fertilization, or IVF, was first carried out back in 1981 and since then has been responsible for the birth of thousands of babies. It was previously referred to as making test tube babies because the man's sperm and the woman's ovum were combined in a test tube. Then they put on some Barry White music and got romantic. Oh yeah, it's great. This procedure gives many couples the opportunity to conceive a child where medical complications might prevent them from doing so naturally. Joining me from the Cape Fertility Clinic is Dr Tamtam to explain IVF further. Welcome to the show.
Thank you very much, Riaad. Thank you for having me on the show.
Doc, you found out, for example, you have a problem with infertility. Now, what other options do you have to actually have a child?
Yes, with fertility, in most cases, the treatment will depend on the cause. So it depends, is it a male factor? Is it a female factor? Is it because the fallopian tubes are blocked? Is it because she's not ovulating? Or is it because of a structural problem with the uterus itself? If it's just a problem with ovulation, that means the woman is not making an egg and everything else is normal, there are medications that we can use to induce ovulation. And then if the tubes are blocked, then those women require in vitro fertilization.
Yes.
Which basically means that we need to give them medication so that the body makes a lot of eggs. The eggs are retrieved outside of the body. So this is where the in vitro comes in. It means that those eggs are fertilized in a laboratory to make the early stages of the baby that we call the embryos. And then those embryos will start dividing into a number of cells. And then we then decide when to insert the embryos back into the uterine cavity. And then unfortunately, there is a long wait after that. Okay, they wait for about 10 to 12 days. We do a blood test. It's usually the longest period of any woman's life who's undergoing in vitro fertilization. If the blood test is positive, we all dance around and it's a big yay. But unfortunately, when it's negative, it's sad. And I have to stress this point that in vitro fertilization is not 100% successful.
Yes.
Success rate depends a lot on age, and women have to be counseled, or couples rather, have to be counseled that they might have to do this a few times before they get a pregnancy.
Let's have a look at what the IVF procedure actually entails.
The first step in IVF is ovarian stimulation, where medication helps the ovaries produce 12 to 15 mature eggs. A few days before the eggs are to be retrieved, a hormone injection is given to trigger maturation of the ovum. The eggs are retrieved and a sperm sample is taken from the partner. In a lab, the eggs and sperm are combined to create fertilized embryos. A doctor then implants 1 or 2 embryos into the uterus, and the rest are frozen for later use if necessary. Next is a 2-week wait to see if the embryo attaches to the walls of the uterus. And if all goes well, a positive pregnancy test is the final step in the IVF journey.
What's the actual cost of the treatment?
It depends on what treatment. So if we're looking at in vitro fertilization, for instance, a cycle can easily cost a couple about 30 to 35,000 rands per cycle.
Yes.
That means per try.
And what's the time period in between attempts?
Well, in most cases, we just skip 1 month just for the woman's body to recover. And if they are psychologically and emotionally and financially ready, then they can continue with the next cycle.
What is the success rate per cycle?
It depends. It depends a lot because, as I said, age of the woman plays a big factor in success rate of any assisted. The
younger you are, the better.
Exactly. So we tend to find that, there's a big drop after the age of 35, about a 10% drop. For in vitro fertilization, for women less than 35, I would put it at about 40% per cycle, and women more than 35, say 35 to 39, probably around 35%. For women more than 40, then that's when the trouble really begins, because we're talking about maybe 20 to less than 20% success rate, even with in vitro fertilization.